Hello, PennDOT Community Traffic Safety Partners. Thank you for joining us for another video which is being produced for you by the Children's Hospital of Philadelphia Center for Injury Research and Prevention. In this video, Chapter 7, we'll talk about evidence-based programs, what they are, the advantages and the disadvantages to adapting evidence-based programs, their characteristics, and how you can understand what evidence really means. So evidence-based programs, why the fuss? There's a lot of talk about evidence-based programs and evidence-based practice. And one of the reasons is because more federal funders are requiring program planners to use evidence-based programs as a foundation for their own work. Some consider evidence that is proven through research. Others consider evidence that is derived from experience or practice. Ideally, the best evidence-based programs may have a combination of both research and practice-based evidence incorporated into their development. So what are evidence-based programs? Evidence-based programs take advantage of the key components of evidence-based practice, which is bringing together the best available scientific evidence, the preferences and the available resources of the target group, and the practical experience and the expertise of experts in the field, all coming together to develop practice that informs programs. Evidence-based programs consider the previous circumstances in which a program or an intervention was implemented, as well as the current circumstances in which the program is going to be considered for implementation, and brings those together so that the adaptation of the evidence-based program can best fit your particular community and audience needs. The advantages of using evidence-based programs are that we know that they're effective for target populations because they've been tested with similar populations in the past. They're typically very cost-effective because a lot of the legwork has already been done in the past, and now we're adopting it for our use in the future. And because it's already been done in the past and we're going to adapt it for our use in the future, it also reduces the time it takes for us to develop a program or to research a community because that work has already been completed. It helps to narrow our evaluation and our focus, but doing so can come with certain disadvantages. Sometimes we find that folks who use evidence-based programs as their base are limited in their flexibility or their creativity because they want to make sure they follow the program exactly as it was originally implemented so that they can be sure to be true to the evidence-based practice. This is really important, but you can be creative by changing, for example, the reading level to fit your community's needs or making the language more culturally relevant. Other disadvantages to using evidence-based programs are that sometimes these programs can take more resources that you can afford, and implementing evidence-based programs can be difficult. It's also not always easy to find out what evidence-based programs are or where to find them. Some key characteristics that can identify for you that a program is evidence-based is that the intervention that was done was based on the best possible science, it had multidisciplinary problem solving, it was based in theory with a systematic program planning approach, it followed sound evaluation principles, and it had results that were disseminated to others who would need to know about the program. Most often that dissemination might come in the form of a peer-reviewed journal article or to a white paper to larger organizations. So what is evidence? Well, evidence is simply the available facts or information that indicates whether a belief or a proposition is true or valid. In other words, it lets us know, did what we do actually work? In public health practice, this can be a collection of data or scientific evidence, which we can sometimes use as guidelines for work or input from community members or stakeholders, and even our own professional experiences. But evidence happens on a continuum or a spectrum from very objective down to pretty subjective evidence. And determining this can really help you to evaluate whether or not a program is going to be a good fit for you. Something that's got really good, solid, objective evidence is a program that maybe used surveillance data or that was incorporated with systematic reviews of multiple intervention studies or an intervention research study that might have taken place. Next down on the list might be a program evaluation, but perhaps more subjective would be evidence that comes from word of mouth or our own personal experiences. Along the continuum of evidence, There's a variety of strengths that we can look towards. Pretty weak evidence would be presented to us if the answers for why we're doing something the way we're doing it are simply, oh, that's the way we've always done it, or that's how the powers that be really want it to be, or my gut says this is how we should follow our plan. When something is evidence informed, that means that they might have used some sort of an outside agency or outside evidence to help them determine the extent of the problem. So perhaps looking at the census or some sort of a registry to help you figure out the overall needs of some of the target audience. Maybe using literature review or looking at similar programs or talking to colleagues and experts to gather consensus about what has worked for others in the past. Evidence-based practices typically can take the form of replication studies over multiple sites, meaning that this is a program or a study which has been implemented multiple times over and over. It's been replicated at different sites and with different populations. And because of that, we know that it stands the test of time and we know that it works. So these evidence-based programs are typically well designed with research, with outcome and impact results, and they're available to you for your use in the resource guide. Please access the Teen Traffic Safety Program database for a variety of evidence-based programs that we have identified which we think can be a helpful starting place for you. Evidence-based adaptation is when we identify the needed adaptations in an evidence-based program. Maybe it's an aspect of their content or an aspect of their delivery that might not be the best fit for our particular audience. But we can take the elements of the program that we feel are really important and that worked and were evidence-based. We can translate them to our own community and our own needs. And then we can determine the level of fidelity. In other words, how closely did we stick to the program as it was originally investigated, originally developed, and originally published? And then use the adaptation guidelines that we discussed in Chapter 6 to help you figure out how to make this program the best fit for what you're doing. One example of an evidence-based program that the CHAP Center for Injury and Research Prevention has developed is the Teen Driving Plan, the TDP program, which is an interactive web-based program which helps parents to really effectively supervise driving practice. This is a program that's been thoroughly studied and has 3 components: a learning component, a planning component, and a logging component. In the learning component, parents get to watch brief videos which help them to learn how to create a positive learning environment for teaching their children how to drive. In the planning component, we developed an interactive practice planner to help families have concrete goals for each of their practice sessions with their teen drivers. And the logging component was about logging and rating how well the practice hours went and how the skill development progressed. So you can visit this site to see some of the latest teen driver research and some evidence-based strategies that we use to develop this program and see if there's something that might be helpful for you. The development of TDP involved 5 years of formative research and a randomized control trial of young drivers and their parent supervisors. So we know the elements of this that works, and we make this available for you. You've just completed Chapter 7 on evidence-based programs. In the next chapter, Chapter 8, we'll talk about some overall important elements of program adaptation and things that you might want to consider as you move forward with evaluating other programs and then adapting them to match the needs of you and your community. Thank you so much for watching.